Let me start with the presentation on a brief overview of validation. First of all, the definition. If you look at validation, what is validation? Validation is establishing documentary or written, usually evidence in the first place, because we want to validate to make sure, of course, that a process functions right. So it's a validation that a procedure, a process, or an activity that you do, either in a laboratory or in a factory situation, maintains the desired level of compliance at all stages. And compliance has to be taken very wide. Compliance can be meeting your specification of your products. It can be meeting the specifications of a specific test that you would like to do, or like we will see this evening, also making sure that certain equipment functions in the right way, for instance, your sterilization process. If you look at validation, we might say that there's it's a spectrum. On the left-hand side, going from, you might say, feed, animal feed, to on the right-hand side, medical devices. And there's everything in between. From feed, you go to animal health. There's more validation requirements there than plant health, typically than food. FSMA, specifically in the United States, and of course companies supplying to the US have some additional validation requirements on top of what normal food companies elsewhere in the world would have. Infant nutrition, infant formula, human health, and as I already said, then medical devices, you might say, is almost at the pinnacle of validation. You might say that almost every step needs to be validated there. Of course, that's an exaggeration. Let me give you also a brief summary of validation in food. For a food company, we typically suggest that companies should create a master validation plan to define what needs to be validated, because most food companies are certified to one or more standards. And with most standards, the mantra, do what you have written down and write down what you do, really goes. So creating a master validation plan, defining what you want to validate, is the first step of actually getting to a wider successful validation approach. And for food companies, there is a list of minimum, you might say a minimum list of items that must be validated. And they are pretty much the same across the board for the major GFSI certification schemes. And it all starts with preventive controls, and that's already language taken from the Food Safety Modernization Act. That includes your CCPs, critical control points, and very often also your operational prerequisite program. Then your sanitation program. If you clean your equipment, you want to make sure it is actually properly clean and that you have done a right job. If you have allergens on site, of course, you need to prevent allergen cross-contamination, and those measures that are in place, certainly if you have shared equipment, again, you want to validate that your approach to prevent cross-contamination of allergens actually works well. Then your rework process, that's also the last mandatory part in a food or feed company that needs to be validated typically. But, and that's again linking it back to your master validation plan, and you do the same thing in pharmaceutical companies. You actually look at what are the risks involved in my processes, and what risks do I need to control. So what risks are of a high enough, you might say, urgency that I really want to do something with it. And that's where any other control deemed important. So the high risk activities, you want to validate those as well. And of course, Validation should always be science-based, but other than that, for food companies, there are no specifically described set of steps to follow. So it can and will be different for, you might say, different pieces of equipment. Validating a sterilization unit, as we might see a little bit more in detail of tonight, will be different from validating a metal detector or validating your rework process, because that's where you're going to dose low quantities, perhaps into new product of existing product that is not totally okay, has been reworked into existing product, for example. The validation master plan should actually describe requirements for validation. And if we look at a more pharmaceutical approach, it goes wider. You have to consider equipment validation, validation of your facilities, especially air treatment is really important, and overpressure, for example, in certain rooms for hygiene reasons, so that's your HVAC systems. Cleaning validation as well, process validation, analytical method validation. We also see that certainly in ISO 17025 certified laboratories. That's where analytical method validation is at the order of the day. And we also see this being adopted by more and more food companies. And last but not least, but perhaps the most difficult of all, is computer system validation. If you have specific software written yourself, you actually want to make sure that, whatever you put into the software generates the right outcome in all circumstances. So that's something that also certainly for pharmaceutical companies and medical equipment companies needs to be part of the overall validation master plan, and needs to be validated. Again, if we take a famous approach, which is applied in a lot of pharmaceutical environments, and quite often also in laboratory environments, it's the famous or infamous V model, where you start out describing the user requirements of a process, of a piece of equipment, of an analytical method. And once you have written down the user requirements, what should it do? You can go in more detail. What is the functional specification? So breaking it down in smaller steps, so that in the end you can actually get to a functional design specification. So how should all the small nitty-gritty things be linked together? And once you have written that down, you can do what is called a design qualification. So you actually start writing down that you think that all those small things should actually be able to work together and do the stuff that you expect them to do. Once you have installed it or have connected the equipment, then you can start doing the installation qualification, and you come back again to your functional design specification. Does it really work? And then you start operating it, and it comes more to the functions of the equipment, of the process. And you verify that whatever you've written down in the functional specification is actually working well. And those two together are quite often called the functional acceptance test. And as a last step, you look at the performance. Does the process or the activity, the equipment really perform what you in the way that you set out for before? And that's then quite often referred to as the site acceptance test. This is at least a high-level model. It doesn't still show you all the details on how to do validation. And as I said earlier in the presentation, the exact mechanics of validation will be different depending on what process, what piece of equipment, and so on you are actually validating. But one thing is sure, it must be science-based. And tonight, and this is the transfer to Benoit in a moment, we're going to look at microbiological validation, and also there are different subtypes. We might say we have the validation of microbiological tests. That's more into a laboratory setting. Or there you can look at product validation. One example, which is at least a hot topic, certainly in the Netherlands and quite a few other countries, is product validation. If you have ready-to-eat products where you might say potential growth of listeria, monocytogenes could take place. By law, at least in Europe, the authorities require you to do validation tests on the product and to show that within the shelf life of the product, listeria cannot grow to levels that could be harmful to the consumer. So that's product validation. And the last one is process validation.